Have you ever noticed that some people can just solve problems better than others? Problem solving actually involves a specific number of steps. And if you learn these steps, not only can you improve your own problem solving, but also that of your clients. Welcome to The Art of Therapy, Season 2, Episode 15.
Yeah, so we're back in our studio, further exploring the art of therapy, and I'm excited to be with you here today.
I share that. I'm also excited.
Okay. So if we just take a step back and just look a little bit at what we discussed the previous episode. So previously we really started to have a look at how talking about our communication, what an important part that is in our relationships, and also how that actually can really assist with conflict resolution. And then even a step further back is that we also looked at circularity and how if a therapist looks at circularity with a client and the relationships that they are in and the mutual contributions that they bring, when they can identify that, how important that is with further conflict resolution as well. Yes.
Yeah, very much. If one just looks at, for the therapist, that capacity to observe in the client and their significant others, how they punctuate causality, linear or circular, and their ability to Metacommunicate or not, that's going to go a long way towards resolving conflicts and problems.
And that's something that we as humans, we deal with on such a constant basis. So being able to do that and having the skills to do that can really go a long way.
Yes, conflict is part of life. And to the extent that we can manage it effectively, we're going to be more effective and it's going to really improve the quality of our well-being and mental well-being. So yes, it's unavoidable.
It's unavoidable. Yes. So we also said that the last time is that there's something else, and that something else is problem solving, and that also that it has a special significance as well. So if we can maybe start to have a look at that and have a look at problem solving.
Okay, this is a biggie because there's a lot involved with problem solving, and just as someone's ability to Metacommunicate will assist them with problem solving, and their ability to punctuate circularly will help them greatly with problem resolution, conflict resolution. So they will both contribute to solving problems. But there's something else in addition to that. There is the skill itself of problem solving, and that is a skill.
Okay.
And of course, Metacommunication and punctuating circularly will contribute, but problem solving itself is another skill. All of these that we're looking at, these interpersonal variables or characteristics, are largely and in many ways learnable. The ones that we're paying careful attention to are ones that we can become adept at, and just how much it can improve mental well-being for ourselves or our clients. So, right, let's look at problem solving.
Okay.
Problem solving is a skill because in order to problem solve effectively, the first thing that we need to do is actually identify what the problem is. And that sounds very obvious, but by and large, and in many times, what actually happens when there's a problem is that we just jump to action. We can, out of anxiety or some strong emotion, we are quickly driven. We can be quite impulsive and jump for the solution without having identified what the problem is. So we need to clearly identify the problem. That's step number one.
It seems so simple, but it actually is. We don't do it. We actually don't go and sit down and think, what is the problem? We just, like you say, we just jump into action and trying to solve things.
Yeah. So often we react when there's a problem. And what it actually requires of us, the first step is to step back and to identify what the problem is clearly. And it's not so difficult to do. It's just difficult to step back in the heat of the moment to clearly identify what the problem is. But that's essential, to clearly identify the problem. The second part to problem solving, or the second step, is having identified what the problem is, or having described the problem very clearly. And this also relates to what we spoke about earlier, that in previous episodes, diagnosis, because diagnosis is effectively logical problem solving, but just for therapeutic purposes. So just as we noted back then, noted now that the second step will be to look at what are the possible causes. So we have to, in effect, we've described the problem, but we have to now diagnose what is causing that problem. What are the possible causes for it? And that needs to be logically connected with what the problem is. So step number 2 is looking and identifying what the possible causes of the problem are.
Okay. That sounds very simple.
It does, doesn't it?
It does, yes. But it's not.
No, because it's not just what is identified by way of number of causes, it's being accurate about it. And that is challenging.
It's not just your perception and how you feel about it. It's actually really looking at it and what is causing these difficulties.
Yes.
What's the possible causes?
Yes.
Because there's very possibly more than one aspect to look at.
Very much. And you've said it's not just our own perception. It's what is more objectively causing the problem. And for this, we can refer to, it may be helpful just to look at some of Ray Dalio's work, his book on principles. It's a beautiful book in terms of this particular application. There are a number of applications, but one is around reality testing and problem solving. And part of that is that we've got to be able to perceive reality accurately. And all of us have differences in the way we perceive reality. We've got strengths. And we need to rely on others where we have a certain limitation or weakness in our ability to then perceive that slice or segment of reality. And very often our weaknesses are the strengths of those who we're journeying with and are close to. And their possible limitations will often be our strengths. So we support one another. And this is the same for the client with their significant others. So the first part is being able to identify and perceive reality accurately as it relates to the cause of the problem. And then the next thing is we've got to keep that in mind and keep it clear, because we very often distort it. Either because what we're seeing is unpleasant, uncomfortable. We just don't want it to be like that. And so we subjectively distort it, either by putting a lens on the situation or framing it in a certain way that helps us to feel better about it. But when we're doing that, we're actually distorting the reality of the situation.
Which means that we actually can't accurately problem solve it. We can't resolve it.
No, indeed. It's just not possible. So what is needed is to accurately perceive the problem and accurately understand what's causing the problem and maintain that perception and not distort it in any way.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za. sounds so easy when you say it, but
Simple.
it's simple. And I think that when you talk about it like that, it is just it is actually so complex because this is not someone that's trained in communication. It is for clients that they have to deal with this on a daily basis.
Yes.
Every day there is some difficulty that people have to resolve. And being able to identify it most accurately and then understanding the causes, but being very objective about it.
Yes. Yeah, you're so right. With this, we're solving problems all the time, but usually we're just reacting.
Yes.
Very rarely do we step back and consider what is involved in problem solving and then learn the skills around problem solving, because we just live life. We just cope, very often just surviving. But the moment then one can step back and begin to recognize that it's a skill and it's a learnable, it's a trainable skill. But moreover, that the therapist with some training can begin to look at the client and their capacity for problem solving and the significant others in the client system. That becomes key. But I'm getting a bit ahead of myself because we're only at step 2 in effective problem solving. So we've accurately described the problem, and then in step 2, we have tried as far as possible to accurately understand the causes, possible causes of that problem, doing so accurately, realistically, and maintaining it so. If we can do that, then step number 3 is we need to generate a series of solutions, possible solutions that relate to what we believe to be the cause of the problem. And once we've got a number of possible solutions, we have to trial them systematically, one at a time. What we often tend to do is just, in an ad hoc way, just jump for possible solutions, try, go to another one, half completed, go back to the first, jumping around in terms of what we're applying, in terms of possible solutions. But we've got to learn to do that very systematically, do it thoroughly and completely. And again, then check in on the problem. Has that resolved the problem? If not, move for the next and the next and the next until that problem is resolved.
The way you describe it makes so much logical sense, but it's so much harder to do it in day-to-day living.
Yes.
And it just makes me think of something that therapists deals with frequently. It's if a client comes to you and they say to you, look, my child just doesn't want to go to school. It's a mission every morning for them to go to school. And then what parents usually do, and all of us included, is just trying to resolve, just trying to encourage, just trying to get them to school.
Yes.
But actually not understanding, okay, what is the problem exactly, describing it accurately, and then trying to understand what is the causes behind it, what is causing the child to have difficulty going to school. And then logically and systematically trying different solutions, and every time checking in on whether the difficulty of going to school is actually resolved.
Yes. You've described it beautifully, because that's really what happens. For most parents, it's just trying to get through the morning, just trying to do it. And it's the same thing very often each morning, and either trying to encourage, coax, persuade, pressure, bribe, surprise, Patricia's. There are all sorts of strategies that parents apply, but without stepping back. And that's often where they reach out to help to the therapist, where with the therapist, they can then step back and begin to identify, describe the problem, look for possible causes with the therapist's help, and then look at possible solutions and begin trialing them. And that's often what is part of the therapeutic process, which is so meaningful. Now, for our purposes, again, we want to be looking at just in making sense of the client's presenting problem, how does their capacity for problem solving relate, if so, or not at all? And their capacity for problem solving and those in their system, their significant others, what's their capacity for problem solving? And does that relate in any way to the presenting problem?
It's beautiful. So a therapist can really look at that, and it's not a one solution for everyone or one way to assist with problem solving. It's really seeing to what degree does a client work with problem solving, and what is their capacity with it, and then meeting them again at where they are at, and if it is needed, then assisting in that area of problem solving.
Very much. Yeah, it's beautifully person and client centered. And it makes the therapeutic process, treatment and therapy, healing really unique to each person, each interaction.
Yeah, so now we've really looked at three very important skills at conflict resolution, because in essence that is a conflict. Problem solving is part of conflict resolution. And the qualities that we looked at is both that understanding the circularity of the client and the significant others in their lives, and to what degree do they acknowledge and look at mutual contributions. But then also how they talk about communication, so about how they deal with if they actually utilize metacommunication in trying to resolve conflict. And then the third one here is then problem solving skills and their ability to accurately describe, but then also understanding the causes from objective experience, and then logically and systematically be going through solutions to be able to assist with that. So those three elements are really important in conflict resolution.
Yes, crystal clear.
Crystal
You got
clear.
it.
Okay. Yeah, so it just makes you think that there's so many things that we've started to have a look at, and it feel like every one of them just fits into the next one. So it just makes me wonder, is there more that relates to our mental well-being?
Well, certainly there is. And something that we could consider, it's a difficult one. It's the nitty-gritty of control.
Yo, okay. Sounds like a hard one to look at.
Yes.
Okay, so looking forward to exploring that with you further then in our next episode.
Thank you for joining us on The Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.